Welcome to the second annual member summit. Good morning, good afternoon, good evening, depending on where you're joining us from the world, virtually to this Self-Care Trailblazer Group annual summit. Next slide, please. Before we begin, I'd like to go through a few logistics. And the first is that this session will be held in English, French, and Spanish. And at the bottom of your screen, you're going to see a toolbar with a click on the, it has a click of a globe that is labeled interpretation. And choose the language that you'd like to hear the summit to be delivered in, either English or French or Spanish. And you'll be added to the audio channel of your choice. But please keep in mind that you have the ability to switch between channels of your choice. I'll also take a moment to give you a few instructions in French and Spanish, and I'd like to invite Sandy. Can you please give the instructions in French? Sandy, are you there?
Can you Solome, I'll take it the Spanish then. Solome, okay, sure, I'll take the Spanish. Buenos días. Por favor, sigan las siguientes instrucciones para ajustar su configuración de idioma. Si miran bien, en la parte inferior de su pantalla, en la barra de herramientas, haga clic en el botón de interpretación. Elija en qué idioma le gustaría escuchar el programa. English, inglés, o French, francés, o Spanish, español. Entonces se les va a añadir al canal de audio de su elección. Después de su elección, tenga en cuenta la opción de alternar entre canales si así lo desea. Et maintenant en français. Suivez les consignes ci-dessus afin de choisir la langue privilégiée. Au bas de votre écran, dans la barre d'outils, cliquez sur le bouton intitulé Interprétation. Choisissez la langue dans laquelle vous souhaitez suivre le sommet, en anglais ou en français ou en espagnol. Vous serez ensuite connecté à la chaîne d'audio de votre choix. Notez que vous aurez la possibilité de basculer entre les chaînes d'audio si vous le souhaitez. Merci. Okay, Salome, in English, in Spanish, and in French.
Thank you very much, Belka. Sandy.
Salome, you can go ahead. Milka has said it in French.
Okay, thank you very much. Merci, gracias, Milka, for the translation in both English and French, and in both Spanish and French. I'd like to apologize for us starting late, but it's good that we've started and we're here and the numbers are still growing. We'll be displaying our slides in English on the screen, but you can really access them in French and Spanish when you click on the box that is on the slides, and it gives you the various options of the languages. Next slide, please. And then another thing is that we'd like to make today's session very interactive. A lot of work we've done over the year. And so as much as possible, we'd like to hear from you throughout the session. On the screen, you can see a QR code along with the website menti.com. You either take out your phone and scan the QR code as it is indicated on the screen, or open a tab on your browser and go to menti.com and enter the code. Please keep this throughout the whole event, as we'll be asking questions and want to hear your answers throughout the Menti poll. You can also let us know if you agree or like to share what we shared by clicking the heart emoji that is on your Menti screen. Next slide, please. Now that we've addressed the logistics, I'd like to introduce myself. I am Solome Nakaweesi-Kimbugwe. I chair the Self-Care Trailblazer Group Coalition Steering Committee. I am an international development consultant who specializes in progressive social movement building, especially feminist movements, sexual and reproductive health and rights movements, a lot of work around organizational development, human rights, and governance. I am based in Kampala, Uganda, East Africa, and I'll be moderating the session today, along with some of my colleagues from the SCTG Steering Committee, as well as the Secretariat. I'd like to express a huge thank you for all of you for being there. We have more than 250 countries. As you can see on the map, 250 registrants from 39 countries that are represented from all over the world. And it is really a global movement of practitioners and people that are joining us today. And you see the countries that are joining us are the 39 that are highlighted in green when you look at that map. And of course, this is only from the registration that we got as of last Friday, when people put in their final registrations. This being a webinar, we can't be able to speak directly, although we would have wanted to. But please use the chat to introduce yourself, your country of residence, your organization, and if you're a member of the SCTG, or if you're here to know more about us. We want to hear from you and see who is here with us today. Next slide, please. For those that are not members, we'd like to share a little about our coalition. We as SCTG envision a world where the practice of self-care leads to a more inclusive, equitable, and people-centered approach in optimizing health and well-being across the globe. And our mission is that the SCTG is a global coalition dedicated to expanding the safe and effective practice of self-care so that individuals can better manage their own health outcomes and are improved, and health systems are better equipped to achieve universal health coverage. Next slide, please. The power of us being as the Self-Care Trailblazer Group is in our members. And we have active members from across the world working to advance self-care policies, programs, and practice. We ask our members to share their successes and make videos telling us about their self-care journeys in the last 1 year and the wins that they've made in the last 1 year. We have heard from you and would like to share with you these wins. Join me to enjoy the video of what the wins are for our members across the globe.
My name is Bridget Kurgat and I work for Days for Girls International and reside in Kenya. In a society where menstrual health is a taboo and impedes menstrual equity, last year, Days for Girls reached a total of 252,000 girls through our locally led social enterprises and 184,000 women through our volunteer program with social norms conversation that equip them with the skills they need to manage their personal hygiene and navigate menstrual symptoms, including when to manage at home and when to seek medical help. This has in turn created a positive behavior change in menstrual health conversations. Thank you.
My name is Dr. Alessandra Uchoma, and I work with MDoc Healthcare as a communications associate. MDoc is a digital health company based in Lagos, Nigeria that provides virtual self-care support to people living with regular and chronic health conditions. To date, we have over 71,000 members on Complete Health, our digital health platform, and about 85% of these members are women of reproductive age. Through our work with these women, we have recorded over 51,000 maternal lives saved. MDoc continues to improve the narrative of quality healthcare delivery in underserved populations in Africa.
I'm Tara Adams, movement builder for the White Ribbon Alliance. The White Ribbon Alliance is the advocacy, learning, and technical assistance lead for the SCTG. At the White Ribbon, we believe that self-care has the potential to advance sexual reproductive healthcare services for women and girls, and we are most proud of our role in growing the self-care movement and accelerating country advocacy to expand access to self-care. On behalf of the SCTG, the White Ribbon Alliance organized a groundbreaking self-care learning and discovery series that mobilized over 1,800 people from 119 countries, expanding the coalition's footprint. White Ribbon Alliance also supported advocates from over 10 countries to develop smart advocacy strategies to strengthen the policy environment of self-care in their country.
My name is Dr. Jennifer Yanti, and I work at the Society for Family Health as Deputy Managing Director of Programs and Strategy. I'm also proud to be a self-care ambassador. Over the last year that I've been a self-care ambassador at Nigeria, we've been able to renew our focus as a country on self-care and self-injection. We've been able to do this in a number of ways, including carrying out advocacy visits to states within the country to help them to become more committed to pushing forward the self-care and the self-injection agenda. Over the last few years also, SFH has been able to increase the number of projects that it has carried out concerning self-care in the area of HIV, family planning, reproductive health, and COVID-19.
Hello everyone, I am Dr. Anthony Wando. I am the practice area lead for family planning and reproductive health in Society for Family Health Nigeria.
The Society for Family Health DICS project aims to demonstrate that self-care beginning with contraceptive self-injection is a viable cornerstone of sexual and reproductive health care, which could offer women an increased agency over their own health. Through its interventions, the DICS project has been supporting consumers on self-care by training women to be able to manage their contraceptive needs with the adoption of DMPASC self-inject contraceptives.
Thank you very much for those wonderful videos about your work. Next slide, please. My name is Sarah Onyango, and I'm the Senior Technical Advisor for Self-Care at PSI. I'm also the Director of the Secretariat of the Self-Care Trailblazers Group and co-chair the Evidence and Learning Working Group. It's really exciting to be able to join you here today at this summit, to hear from our members, and also to learn about and hear about your successes around self-care. We'll now take the time to move on to our next presentation. One of our members, the White Ribbon Alliance of Nigeria, will share their successes with us. Christiana Asala will be presenting on behalf of the White Ribbon Alliance. She'll be giving the keynote speech today. Christiana has more than 11 years of experience working across sexual, reproductive, maternal, newborn, child, and adolescent health continuum, including HIV and AIDS in more than 15 states in Nigeria. She's presently the National Coordinator for the White Ribbon Alliance Nigeria, and she will share with us how they have contributed to advancing self-care in Nigeria. Thank you, and welcome, Christiana.
Thank you so much, Sarah, and thank you, SCTG, for the honor. Okay, so I'm giving this speech today on behalf of the Self-Care think tank group in Nigeria, who really has worked collaboratively in advancing self-care in Nigeria. So just a brief overview of how it started. Self-care journey started 2 years ago, specifically in January 2020. And the Federal Ministry of Health, in collaboration with White Ribbon Alliance Nigeria, held a consultation which was attended by multi-stakeholders. And there were quite a number of recommendations and outcomes from that consultation. But I want to emphasize on 3 today. So one, there was a consensus to domesticate the WHO self-care guideline on SRHR. And now what we know as the National Self-Care Guideline on Sexual, Reproductive and Maternal Health in Nigeria. There was also the formation of a self-care think tank group, which really has supported self-care movements in Nigeria to date. And also the need, to work with healthcare workers and associations in advancing self-care. Early on, we've identified that if we must advance self-care in Nigeria, then we need to work, with healthcare workers and have their buy-in, and even have them, as touch points in advancing self-care in Nigeria. So we'll take a look, at a few things of what we've done in the past 1 year. Next slide, please. All right, so we have conducted a comprehensive stakeholder mapping involving the public sector, private sector, civil society organizations, professional and regulatory bodies, because we want an elaborative self-care movement, encompassing of various stakeholders, and various thematic areas. And we also have developed the potential policy mechanism on self-care, which have guided most of our self-care priorities, especially for White Ribbon Alliance Nigeria. We have also collaborated with Federal Ministry of Health to hold stakeholders meeting on self-care. And in one of those meetings, we were able to develop the Nigerian Self-Care Network Charter, which have guided the network so far. We've also supported the Federal Ministry of Health to leverage DMPA self-injection as an entry point for the rollout of other self-care interventions in Nigeria. And I really want to appreciate GSI, Pathfinder, WHO, who have done extensive work, on DMPA in Nigeria, and created an enabling environment, for self-care, to leverage on. And this, platform have actually helped us taking the self-care guideline, developed, in Nigeria to about 15 states in Nigeria, and getting commitments for the rollout of self-care in all of those states. We've also been able to build media momentum on self-care. And through press releases, we held press conferences, press briefing in about 15 states, of course, leveraging on the advocacy state visits we've carried out to those states. We've been able to train over 450 healthcare workers across 15 states. And this is not to mention other program training for healthcare workers. And this, of course, we know it's an entry point really, on self-care for most of communities we are going to be working with. We've been trying to prioritize building the capacity of healthcare workers on self-care, and we plan to do a lot more training this year. We've also conducted, a knowledge, attitude, and practice assessment on community perspective on self-care, and this we did in collaboration with the Self-Care think tank group. And we've had about 470 people responded to the assessment across 14 states. And the findings from these assessments created the baseline for us to develop a social behavior change and demand generation strategy for self-care. Next slide, please. Yeah, so we've developed, this SBC strategy, and presently working on SBC tools, which we plan to do a statewide sensitization on self-care. We have collaborated with stakeholders to provide country-specific policies, strategies, and tools for the successful rollouts of self-care interventions in Nigeria, support the advancement of self-care as part of efforts to provide more client-centric approach to service provision, and also as part of a comprehensive prevention services provision, service providers in the FHI 360 EPIC Act to provide prevention services such as condoms, HIV self-testing, pre-exposure prophylaxis, and digital health solutions for client education. And it also collaborated with Navy to build a chatbot to provide knowledge and improve health-seeking behavior in private and confidential chats. So, going back to the CAP assessment we carried out, there are quite a number of findings, which really has, helped us advance self-care and knowing where to focus on. But I want to bring out a particular finding on where people, community access healthcare services. We wanted to know where they access healthcare services so that we're able to build up on that, to make them have self-care product. Next slide, please. Okay, so while that is coming on, we were, kind of amazed that a lot of people had mentioned that they access or get their healthcare products from health facility, over 50%, and then 24.6% say they get their healthcare products from pharmacy, 9.5% from patent medicine store and NGOs. And this, reinforced our earlier conviction that if we want to really advance self-care in Nigeria, then we have to work alongside healthcare providers. So if more than half of the people we spoke to get their products from health facility, that means we would really need to work with healthcare providers to be able to provide the guidance, counseling, build health literacy also on self-care. And SFH also, under the DISC project, conducted extensive programmatic research, including interviews with early adopters of DMPA-SC, and they're able to hone on the insights of fear of the needle and or pain, and also realize that lack of job aids, addressing the insights of fear of pain, and also lack of training to the healthcare providers, not being able to even address this issue was a major gap, and building the capacity of the healthcare providers on how to address this issue. We saw an average of 70% self-injection conversion rates, for clients who opt for DMPA-SC. So this shows, how working and partnering with healthcare providers can really help and have really helped us advance self-care as a country. Next slide. Okay, so probably let's go to the next two slides, and we'll be looking at the challenges we have faced so far. Next slide. We'll be looking at the challenges we faced so far, trying to advance self-care in Nigeria. And one of the first, next slide please. One of the first thing we have noticed is low awareness of self-care and also self-care products in general. As in general, really, there's really health illiteracy, a high rate of health illiteracy. And we cannot really advance self-care without health literacy. So it's really a challenge we have identified. And low awareness is also on the part of both the provider and patients too. Low awareness have led to a lot of fear among stakeholders on self-care replacing healthcare workers, leading to resistance. And yes, we faced a lot of that at the inception phase. And of course, we have also seen the low level of awareness among stakeholders, making them not even appreciate self-care initiative that patients carry out. And when they come in, they have to redo everything and discourage a lot of community from even doing that. Insufficient data to measure self-care, it's really a big challenge. And this is something I know the Ministry of Health and other partners are really working across to see how we can get the sufficient data. Cost of self-care products and cost of HIV self-testing kits. This is a really big issue. And of course, cost, not just relating to the over-the-counter, cost, but again, if we're saying self-care, probably it's help with cost savings, and people still have to pay out of pocket. People wonder, okay, so who funds this? But of course, we also tell them, over the cost savings really is not just over-the-counter product, but also in relation to the time it takes you to get to the healthcare facility, and also beneficial, to the whole society, and the high cost rate of even private physician appointments and all of that. Can we go to the previous slide? Let's see how we've been able to work with healthcare providers to help us overcome these challenges, building trust. Healthcare providers really stand, have a very pivotal role in building trust. We have seen examples with the SFH program, also act as a point of access, and support to patients on the products to use, how to use them, guide them on how to use them, and also identify danger signs and when to have to refer to a professional, and also just creating that responsible self-care at the community level. Of course, build health literacy, among the community, health promotion and community awareness, which is a very strong strategy for us in our SBC rollouts, working with healthcare providers in doing this. So let's look at the learnings we have gotten so far. And our really strong learnings really is on collaboration across every level. Collaboration with the Federal Ministry of Health, collaboration with partners, with healthcare providers, with the community, having a very, very strong learning to how far, we can actually advance a program. And also the leadership, the healthcare, provide the Federal Ministry of Health have also taken, with advancing self-care. They have really had a strong coordination, with partners, and also been able to leverage self-care on a lot of other programs, and also resource mobilization for self-care. So Federal Ministry of Health, particularly the Department of Reproductive Health, under the leadership of Dr. Klaudia Szymuś, have really done a lot in coordination and building that collaboration. And also that has also, built a very strong self-care think tank group, which have really come together, to build a very strong self-care network in Nigeria. Thank you.
Thank you very much, Christiana, for that really very informative and inspiring presentation. It's helpful for us to hear what Nigeria has done, and also to think about how we can, how what Nigeria has done can be applied in other countries. One of the points you raised in your presentation was about the role that health workers can play in overcoming the challenges to self-care. So we want to continue this conversation in the next session through a plenary discussion on how health workers are critical to strengthening the self-care agenda. This conversation will be moderated by Dr. Pandora Hardtman. Dr. Hardtman is the Chief Nursing and Midwifery Officer at JPIGO and a board member of the International Confederation of Midwives. She has more than 20 years of experience. She has worked in Bangladesh, in Rwanda, Nigeria, Indonesia, Mongolia, and on the Turkish-Syrian border, to name a few. In addition to her role as Chief Nursing and Midwifery Officer, she also works as a clinical midwife in the United States. I'd like to take this opportunity to welcome Dr. Hardtman.
Thank you so much for that warm welcome and the amazing information that we have heard so far about everyone just jumping in on the self-care train. We know that healthcare workers play such an important role in strengthening the connection, that we as healthcare workers, all of us, can help to shape this agenda and advocate for more self-care with policymakers driving the programmatic decisions. But the sad reality is that sometimes as health workers ourselves, we can also be an obstacle, a bit of an obstacle to advancing the self-care policies and programming, because sometimes there are just the concerns, about our clients' ability to correctly use the products or self-diagnose. So that's why we as a healthcare workers are key partners of this amazing Self-Care Trailblazer Group, and why we're working together to educate about the importance. So with us today on this panel to dig a little bit deeper and to educate, as we continually educate about the power of self-care, we have 3 healthcare workers represented who will share with us their thoughts, inputs, and experiences around this area. We have with us today Ms. Annette. Annette is the president of the National Midwives Association of Uganda. She's one of the senior midwives and mentors in the clinical and public service arena in Uganda, and currently works at the China-Uganda Friendship Hospital in Nakuru, and is president of the National Midwives Association, and she's really passionate about the safe motherhood aspect. In addition, we have Mr. Diego Portillo, who is a psychologist and chief of projects from the Instituto Pronando de Paternidad Responsable. Please forgive my Spanish there, which is a Planned Parenthood affiliate. He works on projects related to comprehensive sexual reproductive health education and services, particularly with a focus on adolescents and young people, and also the humanitarian response, which we know is a neglected area. In addition, we have Klaudia, who is a medical student from Poland, serving as a liaison officer for SRH and rights, including a special interest in HIV/AIDS in the International Federation of Medical Students Associations, which represents 1.3 medical students from 130 countries. So you see, we have from us around the globe. I love that we were able to get somebody from the different continents to represent different perspectives on these issues. So welcome to you all, and audience, just a reminder, please, we love the participation and questions to our panelists. So for all of our panel today, let's jump into the conversation and start off with a question. In your opinions, and coming from your different perspectives and locales, how can health workers make sure that their patients and clients are informed and well connected to the different and evolving self-care products and approaches? Annette, why don't we start off with you?
Thank you very much, Dr. Pandora, for this opportunity. Greetings to everyone on the call. I am delighted to be a part of this movement and a part of the summit this afternoon to be able to share with you my perspective as a midwife in clinical practice, where we get to see the needs of the mothers and the girls that we serve.
Still assign me as an interpreter.
I've taken you out of it. I don't know what else.
Yeah, I add my voice to the previous.
I'll have to add myself through a separate email account now. So I'm going to need to log off.
No.
I add my voice to the previous speaker about the need for involving healthcare workers. When we look at the needs of the women, especially the mothers that we take care of, personally, in my experience while at work, I have witnessed the missed opportunities and the related poor outcomes, which could have been averted if self-care had been the mode of care for these patients. And that is related to the first delay that we usually talk about. The first delay implies that the mother or woman should be able to make a decision to take on care. But when mothers do not appreciate that their health is in their hands, then we have these missed opportunities. So I totally see the connection between self-care and averting these unfavorable outcomes. And what, in my opinion, we should do is creating an enabling environment for the women and girls that we care for. We want that environment that can build trust and partnership with the women. You know, we deal with sexuality issues that are quite sensitive. Women are not able to open up if they are not assured of their privacy, of their, non-judgmental care, and all those. They are rights. So when we create this environment, to me, it's the gateway into self-care. Because when you open that environment and build confidence, self-care is an option. It is not the health workers' task, relegating their duties to the clients, power to enable these women to make an informed decision. And we can do that by also availing them with reliable, accurate information. We need to share with them the benefits. We need to share with them, listen to them more than we speak. Let's hear out their concerns and address those concerns, because going by our culture, there are a lot of implications, there are a lot of barriers. So we need to address those existing barriers and provide, demystify the concept of self-care. Yes. And of course, as we do this, we need to ensure that we are maintaining ethical standards. When it comes to midwifery, we cannot understate that. The standards of ensuring a healthy mother with a live baby is critical to our profession. And if there is a strategy, an intervention that is going to maximize this achievement of these standards, achievement of the quality of care, then we need to embrace it as healthcare workers.
Thank you for that, Annette. The reminder to listen more than we speak. And your thoughts on this same question, Diego, how healthcare workers can make sure their clients are well informed and connected. What are your thoughts?
Great, thank you, Pandora. It's my pleasure to be here, and this is an important event to think about the self-care and the possibilities that everybody have to make a little of advocacy. So to answer briefly to your question, first of all, I think that health workers need to strengthen their skills and knowledge around self-care, especially in the development of skills that allow them to respond to the needs of patients and clients, especially if the clients are adolescents and or young people, because if you work with adolescents or young people, this is another kind of challenge.
It seems like technology is perhaps being a challenge as well.
Oh, sorry, Pandora, can you hear me now?
Yes, we can hear you, no problem.
Okay, that's great. So I was saying that for me, this challenge to strengthen the capacities, the skills of the health providers means that we cannot ask health workers to ensure something they don't know now. They don't know. So my first recommendation has to do with training and capacity building. Additionally, I believe that each health worker should have a policy of respectful care and treatment of each client, so that health workers can dialogue with their patients during medical care. In this dialogue, each health worker can discuss the personal care approach with patients, which requires some time for dialogue. So normally, in countries where health systems are saturated or don't have health services available, the time spent in dialogue with each patient is reduced. It's very reduced. So avoiding the possibility of having a fluid dialogue that allows raising awareness and informing the patient about personal care. So these above ideas are very important for me, strengthening the capacities, like capacity building, and give time and a special time to talk about the self-care with all the patients, especially if we are working with adolescents or young people. Thank you.
Thank you, Diego. Claudia, what are your thoughts?
Thank you, Pandora. So I guess most of my points will reflect on what the previous speakers have said already, but I just wanted to start with the fact that in order for healthcare workers to address those topics, they need to be aware themselves on the products and approaches. So I would like to start on the importance of mutual training between healthcare workers so that they can learn about the opportunities and the wide array of choices that they can provide their patients with. I just want to emphasize also what Annette said about listening to the patient, because even if they open up after we are non-judgmental and providing with the non-stigma approach, still there's a big challenge of not listening to the patient's need. Sometimes we behave like we know better, but then the informed consent is crucial for patients to understand and take their own decisions. So something that I was also reflected on in the past is that one of the solutions for that could be to provide a follow-up contact to the patient so that they can contact you in case of any questions without an appointment, and something that comes very handy. They can use it all the time whenever there is a need. And also, being a patient myself, I would appreciate a lot to have a comprehensive information on how to behave with the illness that I might have as a patient. And the last point that I wanted to mention is that as a future doctor, there is this notion that we see that doctors can do everything. They can give information and educate the patient about everything, but something that we try to foster is the interprofessional approach, which is to use the help of dietitians, physiotherapists, psychologists, and just not being afraid to refer patients to those specialists, because they know better and much more about their specialties than us. So it might be much more beneficial for patients to foster those healthy behaviors and practice self-care with the information from other professionals. But overall, it will mean a lot of how we shape our health systems. So it's a lot of reshaping to be done there. So yeah, thank you a lot for the question, and that's all from me.
Well, Claudia, not all from you, because you've raised some interesting points. So I want to follow on a little bit. As a medical student, what's your experience been seeing self-care actually integrated into the education that you're receiving? What are you seeing? Are there gaps that educators can consider for improvement?
Well, thank you. So I think the issue with self-care in my personal medical education was that the concept was not introduced per se. It was maybe narrowed to healthy lifestyles, like doing sports, eating healthy, and so on, but not really how overall we should take care of our own health in many other circumstances. So what I would also reflect on is that as medical students, we were educated a lot what to do with the patient when they appear in the medical facility, what tests to run, what diagnostic we should perform, and so on. But there was not that much focus on communication. But maybe there was, but there was not that much education how to make it effective so that the information stays with the patient. Something else that I would like to bring, that there were some specialties that focused a lot on self-care, and notably that was diabetology and hypertension wards, because patients were very well educated on the diet, on screening, how to monitor themselves a couple of times per day. Something that I noticed is that there was huge underappreciation of digital tools, even in those mentioned specialties. because it's a huge opportunity for us, and it's super handy. But there is still, using paper logs to write your own measurements and so on. So I guess something that to improve over there. And yeah, I guess that would be those will be the main gaps that we do not receive that much information, how to convey health information to the patients, which is the most crucial thing of self-care. Being health literate is something that we should foster among our patients. So yeah, that would be from me.
Thanks, Klaudia. And that piece is so important, right? As we see more and more patients relying on Dr. Google, for their answers. So how to bridge that gap and get the self-care information so that our clients do feel empowered. So spinning a little bit from medicine to midwifery, for you, Annette, what is it that the National Midwives Association of Uganda is doing to advance self-care in its membership and indeed in its reach in the East African region?
Thank you very much, Pandora. Yeah, as the National Midwives Association, I'll build on what Klaudia has said. You find that we've had a lot of knowledge gaps about what self-care is about, because it's not integrated in the curriculum. Sometimes the guidelines, the policies are not well disseminated. So fortunately, a few of us were part of the consultative group when the process was being done in Uganda, and that enlightened us. So as the executive of the National Midwives Association, we ensured that we incorporated self-care into our strategic plan. And among the things that we are doing is to raise awareness among our members. Yeah, so that we bridge the gap. We explore the concept, we share ideas, and we've arranged webinars to do that, because we have people who are champions elsewhere, people who have been promoting these products, who have been working with other organizations. And, because in the association, we encourage networking and sharing experiences. So we've been able to use that to create and increase awareness among our members. And then we also have tried to leverage on other opportunities. I'll give an example. We've just concluded a project where we were doing mentorships at the lower health facilities. So we integrated self-care into these mentorships. We build we explore the midwives' awareness, what their challenges are, what their thoughts are, and share with them that we are experiencing these challenges of failing to meet the targets for maternal health, but there is this opportunity and an alternative for us to empower our clients, and the midwives take it up. Also, during these same mentorships, we've had an opportunity to interact with members of the community. Specifically, we've been able to interact with the community healthcare workers, or what we call the village health teams. And we get to hear what their concerns are. And that's a great opportunity for us to dispel myths that are surrounding self-care. We try to increase self-awareness, because sometimes the members or the communities think that self-care is so sophisticated, but we break it down and say, look, we can start from a certain point. You can start with self-awareness, you can start with self-education. There are these, we explain to them what products are available, because there are quite a number in Uganda. There are various apps. But when you inquire from these people, the beneficiaries, sometimes they don't know. So as an association, we've taken it on to us to ensure that we be a part of the movement that is spreading the message about this alternative. And then,
Thanks so much, Annette. You guys are doing a lot. I'm amazed of how you've just taken this on and taking it to heart. It's amazing. I see there's lots and lots that we can share. We're going to need a whole separate session on just what the midwives are doing in this. But forgive me for jumping in, because I know that we're doing a lot and we're going to follow up for sure. But I want to pull the perspective of our Diego, who's been sitting there quietly a little bit listening to us as another kind of an advocate for this. And to get his take, you see what the midwives are doing, for example, what the medical students are doing. How can we advocate for systems, an entire system, national health systems, private health systems that are gonna take on this and embolden the self-care processes for the persons and the providers? What are your thoughts on this?
Thank you, Pandora. The question is very interesting, but it cannot be answered by thinking only of health providers. It must be thought of from the health system. In other words, the health system must make a commitment to implement services, for example, for adolescents and young people, even more so from a self-care approach. And that means making concrete, specific commitments to improve health services for adolescents and young people. The commitments and concrete actions can be evaluating and monitoring comprehensive services, supervising the execution of comprehensive services, give voice the adolescents and young people to be part of feedback process, for example, implement technical training processes for strengthening of knowledge, but also of the skills that the health providers need to provide quality healthcare, and other kind of options. We can make a long list of specific commitments, concrete actions that we can achieve in order to enhance the health systems. But all these actions can be worked from advocacy efforts, because we can get meetings with like stakeholders or important people that can take decisions. We need to do this work, this effort of advocacy to enhance the health system. And finally, each health worker, thinking only in the health worker, have the responsibility during the care process, a responsibility to actively listen to the needs of the adolescents and young people, for example. A responsibility not only to listen, but also to understand, treat with respect, and validate the experience of the adolescent, of young person, because these experiences are real, and that it requires all possible care and counseling during the chain of health care. And I think it's very important work with the health systems, trying to enhance it, and work with the health workers, trying to enhance their skills to during the healthcare attention. Thank you.
Thank you so much, Diego. And our final question actually is going to involve everybody. So those of you who are able in your chat box, panelists, hang on for a second, but audience, here's a question for you. Please, what challenges do you face? Think about those challenges. And so now I want everybody who's able to type to write in, what do you think can be done to address the challenges of bringing self-care as a common thread for everyone? So everybody go 1, 2, 3, type away for everybody so that we can learn from each other and take suggestions. One thing I am saying is that listening is the key. The active listening. I often think how the grandmothers used to say, you've got 2 ears and 1 mouth. So incorporating all our listening into pushing this self-care forward for everyone. So panelists, as we wrap up this session that I think has sparked so many questions, and we're looking at the chat box and hearing about the issues of delay in access and affordability, which are all great sub-themes, which the steering group will continue to drive forward. One word of advice that you would give to think about self-care. One word, what would you say in terms of inspiration and hope as we do this? Annette, one word for us? I think we might have lost her. Klaudia?
Okay, so for myself, I think the biggest word of advice would be to stay educated as healthcare workers and educate fellow healthcare workers and young professionals.
Stay educated. Diego, what would you say?
Yeah, well, there is a lot of challenge.
One word of advice.
One, well, I believe that the main barrier, or one of the main barriers, is that very rarely do we consider the point of view of young people. If we are working on adolescents or young people, we plan clinical care system from an adult perspective and under what we believe is best for adolescents and young people, but we do not enable prior spaces for dialogue. So I think if we need prior spaces for dialogue, we are going to enhance a little the health system for these people, for young people.
Fantastic. Annette, are you still with us? One
Yes.
word of advice, one sentence.
I would say self-care is safe and an answer to our challenges in healthcare. Yes.
Thank you so much to my esteemed panelists from different perspectives. And there we have those words of wise wisdom to continue to actively listen, stay educated, and consider all points of diverse viewpoints as we continue to address self-care holistically. Thank you all for your thoughts and insights. Over to you, Sarah.
Thank you so much, Pandora, and thank you to all our panelists for those amazing insights on the topic of self-care, and particularly around how we can engage health workers more. I think we've really had some good insights representing perspectives of, medical students, perspectives of midwives, but also we've had a lot about insights from service providers and young people, etc. So please continue to make your inputs in the chat box so that we can broaden that conversation. We have a 2-hour session, and so we'd like to now take a small break. We'd like to take a 5-minute break to allow you to stretch a little, go for a bio break, and get energized for the next session. Hello, everyone. Welcome back to the session. I hope you're able to have a good break and stretch your leg a little. So now we are energized for the next session. This session will be moderated by Aissatou, a member of the SCTG Coalition Steering Committee. Welcome, Aissatou.
Thank you very much, Sarah. Yeah, putting my video on. Okay, thank you. Bonjour à tous et bienvenue. Merci de prendre part à ce sommet. Alors, je suis Aissatou Thioye, membre du comité de pilotage de la coalition du Self-Care Trailblazer Group, et je travaille au sein de la division de l'utilisation et de la recherche de FHI 360 et également pour le projet Knowledge Success en tant que responsable de la gestion des connaissances et des partenariats pour l'Afrique de l'Ouest. Alors, j'ai le plaisir de modérer cette session sur les gains et le travail à venir du Self-Care Trailblazer Group. Et en ce sens, nous entendrons aujourd'hui les présentations de 2 réseaux nationaux d'auto-soins, du Self-Care Trailblazer Group ainsi que de ces groupes de travail. Nous allons aussi utiliser le site menti.com que nous avons demandé de consulter plus tôt dans la journée. Alors, sans plus tarder, nous allons démarrer et allons commencer par vous parler du travail que PAF réalise au Sénégal pour y faire progresser les auto-soins. Donc, j'ai le plaisir de vous présenter ma collègue Ida Ndione. Ida est chargée de programme senior pour PAF au Sénégal, où elle dirige les travaux sur les auto-soins en matière de santé sexuelle et reproductive, ainsi que sur les maladies non transmissibles. Elle apporte un soutien technique à la division de la santé maternelle et infantile du ministère de la Santé en convoquant le groupe des pionniers de l'auto-soin et en élaborant des directives nationales sur l'auto-soin. Ida, bienvenue et la parole est à vous.
Merci beaucoup, merci Aissatou, et je suis ravie de participer à ce partage, à ce sommet, d'autant plus que Aissatou est également membre du groupe des pionniers de l'auto-soin. Très bien. So, okay, thank you. Can you hear me well? Next slide, please. So I'm very glad to be here and to participate on this summit and share Senegal experience in self-care. So I share this slide because we have built the momentum of self-care in Senegal through the self-health system structure and required by WHO. And we have a great contribution of healthcare providers. Next slide, please. So here I present the Self-Care Pioneers Group in Senegal, who has built this momentum of self-care in Senegal. And under the Ministry of Health leadership, the Senegal Self-Care Pioneers Group contributes strongly under a co-creation process. And at all levels of care, we have brainstormed what self-care used to be in Senegal. Next slide, please. So the main major achievement we have had in Senegal this year in 2021 was to develop the self-care guideline. And this one is a broader guideline including maternal and child health and child-born health. We also have reproductive health, non-communicable diseases, including self-testing of HPV cancer, breast cancer, diabetes and hypertension. We also have HIV. So what we have done is to build from the existing intervention in Senegal, and one of them is the use of DMPA-EC as self-injection methods. The self-care help to improve access of care so that we have learned more about how the self-care can support the healthcare providers' work. Working on self-care in Senegal mean also that we need to put the health in people's hands and give more autonomy. So discussing this with the civil society's member and community health workers have strongly participated in this process. What is important is that we have understand that the self-care can optimize the time for the healthcare workers. Next slide, please. So one component of the self-care is to highlight the importance of access to care. We also have identified barriers and opportunities in Senegal. In each level of care, for example, in the health system level, the central level, we have identified the data reporting because it is important to keep the client and patient in the health system and monitor, document the self-care services. We also have the needs of trainings and materials to support job aids, for example, to support the self-care work in Senegal. So building this self-care guideline have helped to see where we need to move forward in this here, and these job aids and materials need to be developed to support the healthcare providers. Awareness and capacity building is also important for health users because they need to understand that they have autonomy and can monitor their own health. All these challenges constitute opportunities for us in Senegal, and adding the digital solutions perspective is one of them to help providers and health system to document information. Also, we have had the opportunity to advocate the integration of self-care engagement during the FP 2030 forum, and we hope that this could help to better perform the access of product in family planning services. We continue to disseminate the guidelines for the implementation partners as in Senegal, we start to have programs in self-care. Next slide, please. So I would like to finish here with this photo, as we have a great contribution and brainstorm with healthcare provider how self-care intervention could supported the health system in Senegal. So it is for me an important thing to highlight the role of healthcare providers in the self-care momentum in Senegal. So thank you for listening, and I'm happy to respond to your questions. Over to you, Aissatou.
Merci beaucoup, Ida, pour cette brillante présentation. Merci beaucoup. Merci, Ida, pour cette belle présentation. Alors, maintenant, nous allons passer la parole à Anna. Anna Kukundakwe va maintenant nous parler du travail que le Centre pour la santé, les droits de l'homme et le développement CEHURD accomplit pour promouvoir l'auto-soin en Ouganda. Donc, Anna est responsable de programme au CEHURD. Elle travaille dans le domaine de la santé sexuelle et reproductive et défend les droits des filles et également des femmes. Anna, welcome and over to you.
Thank you so much. Allow me not to turn on my video. I have a very not good internet connection. So for me to be able to sustain this conversation, I need all the internet strength that I need. My name is Anna Kukundakwe. I work at the Center for Health, Human Rights and Development, a research and advocacy civil society organization that works towards the justiciability of the right to health in Uganda, East Africa, and globally. We are also the National Self-Care Advocacy Lead for Uganda, and the work that we're going to be presenting is a clear indication of the milestone that we have been able to put together in collaboration with other stakeholders in Uganda. Next, please. So from the onset, when we were selected, it was very critical for us to do an environmental scan, a legal and policy environmental scan. And as such, we decided to do a legal and policy mapping and analysis of where about 30 laws and policies from both at the national and international level were analyzed, and where we also identified advocacy opportunities. Majority of our laws and policies are blind to self-care and do not explicitly recognize self-care as a key health intervention. With this, we were able to present this and brought this to the attention of the Ministry of Health, who welcomed and supported us. And as we have this call now, more than 3 policies at the national level have had self-care integrated and incorporated as a key health intervention. We also realized that healthcare, self-care is not it's not a homogeneous, it's a relatively new concept, and it's not easily understood by everybody. So we decided to embark on an awareness creation process. Here we tried to unpack some of the self-care concepts, but also try to bring these conversations home into concepts that were easily understood at a country level. As again, that national self-care lead, we worked in collaboration with the self-care partners in Uganda and the self-care expert group. We defined the national agenda for advocacy for self-care in Uganda. And this was through a development of a national advocacy strategy that highlighted advocacy opportunities and the amount of institutionalization. Again, with Uganda developing the national guideline for self-care, sexual reproductive health and rights, the guidelines were answering most of the questions, the what and when. So we decided to collaborate with the Ministry of Health in developing the standard operation procedures, and this defined the how question of the guideline. And as we speak, the guideline is being implemented in one of the districts in Mukono, in Uganda, as we document lessons, challenges, but also success stories. We also leveraged on global opportunities like
Anna? Anna, do you hear me?
to amplify self-care as a critical health thing to learn Senegal, Nigeria, and which lessons we brought for care. Next slide, please. Next slide, please. Thank you. Those are some of the knowledge products that you've been able to develop. I'll quickly go through the challenges, like highlighted. Majority, next slide, please. Majority of our laws and policies are blind to self-care, and hence that creates an progressive legal and policy environment that we all need to work towards changing. There is limited understanding of self-care in our country. When you talk about self-care, people easily think to wellness, have a limited understanding of self-care. So they only look at wellness and treating yourself nice, but that when it goes to the context of sexual reproductive health and rights, that is not very clearly understood by majority of the population. The fear of abuse, and these are views that we have gotten from healthcare providers who fear that this can easily be abused. And therefore, that is another challenge that we are trying to make sure that we address and make sure that we tighten up the legal liabilities that may come in an event that it's actually abused. Lastly, potential opposition. Especially for self-care, most of the healthcare workers actually look at self-care as a replacement to their contribution to the healthcare system, other than a supplement. We have a healthcare worker who we work with who has since distanced themselves from a project because they think that this is in violation of their ethical obligation and the oath of conduct that they actually swore in their school. Next.
Thank you, Anna. It is very interesting, but you have just 1 minute. We can let you conclude. Okay. It seems that we are at time. So, nous allons poursuivre. Merci beaucoup, Anna. Désolée, c'est vraiment très intéressant, mais nous sommes rattrapés par le temps. Alors, maintenant, je pense que nous avons déjà entendu le Sénégal et l'Ouganda, ainsi que le Nigeria, donc plutôt dans la journée. Et ces pays sont à l'avant-garde de l'avancement des politiques d'auto-soin dans leur pays. Maintenant, nous voulons connaître votre avis, à vous, chers participants. Et pour cela, nous vous invitons à aller sur la page Mentimeter que vous avez ouverte précédemment. Et ma question est la suivante. Y a-t-il des leçons apprises du Nigeria, de l'Ouganda et du Sénégal que vous pouvez appliquer au plaidoyer dans votre pays? Vous pouvez taper directement votre réponse dans la case et elles apparaîtront sur mon écran comme c'est le cas présentement. Super. So, je vois the need to integrate self-care in policies and guidelines. Le besoin d'intégrer l'auto-soin dans les politiques et les guides. Develop national self-care guidelines using Sénégal exemple. Ouais, ça c'est de voir comment utiliser l'exemple du Sénégal pour développer un guide national d'auto-soin. Partnering with health workers, ça c'est revenu plusieurs fois dans la journée. Prepare for opposition. Landscaping of regulatory and policies was an interesting piece from Uganda. OK, super. Je pense qu'il y a d'intéressants commentaires que nous avons sur Menti. C'est super. Alors, je pense que nous allons poursuivre. On avait juste quelques minutes pour cette partie, mais ne vous en faites pas. Rassurez-vous, on va suivre, on va utiliser tous ces commentaires pour nous assurer qu'ils seront bien intégrés dans ce que nous allons faire prochainement et ce que nous devons partager avec vous. Next slide, please. Merci beaucoup. Merci à tous d'avoir partagé vos commentaires. Donc, comme j'ai dit tout à l'heure, nous allons les recueillir afin qu'ils puissent éclairer le travail du Self-Care Trailblazer Group à l'avenir. Maintenant, nous voulons entendre les groupes de travail du Self-Care Trailblazer Group. et nous allons commencer par le docteur Dinesh Kumar. Dr Kumar est membre du groupe de travail sur les données probantes et l'apprentissage et il va aujourd'hui nous parler de ce groupe et de son expérience. Dr. Dinesh, welcome.
Thank you very much for giving me the opportunity. So I would start with my experience working with the Evidence and Learning Working Group, and which is one of another function apart from Advocacy and Communication, Learning Lab, and Community Engagement of SCTG. Next slide, please. Okay, so it's we are a multi-sectoral and multi-centric platform. You can see the partners. It's all over from the world. Next slide, please. What we do, so we do elevate evidence and expertise of members. We do co-develop learning resources for global goods. We do support use and application of apps, especially within the country context. All these three functions will help us to accelerate, scale up, and sustain policy and practice of self-care within health systems to achieve universal health coverage. Next slide, please. In my experience as a member, I would say that it's a very interactive and international platform where a group of like-minded people, they come with problem-solving approach. And here, time value the most. I haven't seen such a punctual platform, that too online. And it has a very effective engagement mechanisms with reciprocity. So with my experience, I've been able to apply digital technology to improve individual participation for self-care in areas like diet, type 2 diabetes mellitus, family planning involving both men and women. Next slide, please. So what is our success? The success is that, our membership has not only grew from 57 to 315, but it's also diversified as 16% are representing from Global South. And we also have increased our quarterly meeting participation. So what we have done by doing this, so we have completed 2 work streams, focusing self-care policy mapping and social and behavioral change for self-care framework. We all launched 3 new work streams, measurement, evidence mapping and prioritization, costing and financing. We also have formed first peer learning community around social and behavioral change framework to translate theory to practice. So 46% of members are using our tools. And we have submitted 4 pre-formed panels and 1 individual abstract to the International Conference of Family Planning 2022. Next slide, please. So of course, there are some challenges. We have tried to form some solutions, like first challenge, how we are going to bridge theory to policy and practice. So we would say that apply framework and tools by the LWEB. Second challenge is which approach we should follow, breadth or depth, like horizontal or vertical. We would say, since self-care is a cross-cutting phenomena, so we would say that to address self-care intervention and bring out the self-care products within time and budget. Yes, internet has been a global issue because of, I wouldn't say that availability of internet only, but the speed of internet across the world. Next slide, please. Okay, most of the information you can see at our website, but still going through quickly that how you can participate. Very simple, you can join the quarterly meeting of LWEG. LWEG is Evidence Learning and Working Group. This is what we call LWEG, and you can also apply the tool and framework developed by the LWEG, like quality of self-care framework, digital self-care framework, self-care policy mapping tool, social and behavior change for self-care framework. All these are available at our website. So also by doing that, you can collaborate with the members, LWEG members, on documenting your evidence for peer-reviewed journals through conducting studies, which you can decide. And you can also define opportunities in collaboration, and you can suggest suggestions to LWEG leadership team, the email given below. Next slide, please. Who should get involved? Yeah, whosoever wants to advance the policy and practice of self-care through collating the evidence and generating and or applying resources. So our current members are, as I told in second slide, it's a diversified group. It has implementers both from national and international areas, people who are working in self-care organizations, women health, abortion, sexual and reproductive rights. We also have healthcare professionals of specialties like obstetrics and gynecology, physician, nurses, counselor, midwives, epidemiologists, biostatistician. We have people from academia, policymaker, Ministry of Health representatives, and member of national technical working groups. Also, we do have representation from donors and philanthropists. Next slide, please. My closing thoughts are that based on my personal experience as a medical teacher from North India, I would say that LWEG is a phenomenal platform, not only to work for a cause as a self-care, but also for personal learning. It has been a pleasure to be a part of group and willing to extend and sustain my roles and responsibilities to LWEG. I encourage others to join and actively participate in the LWEG. Thank you. Next slide, please. Yeah, it says thanks. Thanks a lot. Thanks a lot for the opportunity.
Thank you, Dr. Kumar. Merci beaucoup. Merci de nous avoir parlé du groupe de travail sur les preuves et l'apprentissage, donc de tout ce que vous êtes en train de faire et qui est vraiment très intéressant. Next slide, please. Voilà, alors nous allons retourner à la page Mentimeter. Nous avons une autre question pour vous. Et cette fois-ci, elle est la suivante. Donc, nous souhaitons que vous aussi, vous partagiez avec nous vos commentaires, vos avis. Et dites-nous de quelle manière vous souhaitez vous engager. Nous souhaitons vraiment connaître votre avis afin de nous assurer que le groupe de travail sur les preuves et l'apprentissage répond parfaitement à vos besoins. Donc, nous allons nous y mettre. On a juste 2 minutes. Okay, policy making, SC framework, SBCC and research. Oui, c'est important. All of them, ok. Donc, tout ce qui a été présenté ici est important dans le cadre de votre travail. Ça, c'est vrai. Tout était intéressant. Place to share learning. Ok, des cadres de partage et d'apprentissage. Je pense que c'est vraiment important dans le cadre du groupe des pionniers de l'auto-soin des différents pays. C'est toujours important de favoriser le partage, de favoriser l'apprentissage. OK, all dissemination and support for utilisation. OK, c'est important. Non seulement au-delà de disséminer tout ce que nous faisons dans nos pays, tout ce que nous faisons dans nos groupes, c'est également de pouvoir utiliser les informations qui sont partagées. All of them. OK, donc ça va de soi. Tout a été vraiment intéressant et merci encore, Dr. Kumar, pour cette brillante présentation. Je pense que ce sont les mêmes réponses qui reviennent. Elles se rejoignent toutes. Donc, en résumé, tout ce qui a été présenté ici est important dans le cadre de votre travail pour l'auto-soin. Nous allons maintenant poursuivre. Next slide, please. Nous allons toujours poursuivre avec les groupes de travail. Et cette fois-ci, nous avons le plaisir d'écouter Sandy Garçon. Donc, Sandy a piloté la fondation et le développement du Self-Care Trailblazer Group. Il a également été le directeur du secrétariat jusqu'en octobre 2020. Et actuellement, il co-préside le groupe de travail sur le plaidoyer et les communications mondiales du Self-Care Trailblazer Group. Bienvenue, Sandy.
Thank you very much, Aissatou. Hello, everyone. Apologies for any technical glitches. My name is Sandy Garçon. I'm one of the co-chairs for the GAC. Next slide. So in the interest of time, I will try to breeze through this as much as possible. So the GAC is one of the main working groups within the SCTG. Our work really is threefold. First off is around building awareness and support for quality evidence-based self-care, and also leading self-care opposition mitigation efforts, because we know that's also part of the effort. We also work to advocate for self-care to become a component of to be seen as a component of primary healthcare, and also an essential building block to universal health coverage. And the third component really falls along the line of cultivating both donor interest in self-care, but also motivating donors to support self-care work, whether that falls within implementation, research, policy, etc. And ultimately, our efforts will contribute to self-care being included in primary healthcare in UHC resolutions, whether it's at the global or regional level, along the lines of guidelines, but also in terms of financing and programming. Next slide, please. I do want to highlight some of our key successes and activities in 2021. Within the bucket of awareness building and support for self-care, the GAC leadership team is, as some of you may know, we're also responsible for the monthly newsletter, which goes out to a little bit over 400 members and nearly 3,000 external partners. This is a newsletter that goes out on a monthly basis. We invite you, if you haven't done so, please send us any kind of publications, content about your own work, events, and resources in self-care, and we'll be more than happy to include them in the next issue of the SCTG newsletter. The GAC also developed the Self-Care for UHC Advocacy Toolkit. It's a packet of resources that ranges from our messaging platform on self-care. There's a frequently asked question tool, infographic, a brochure about the SCTG. We've also included a policy brief template and also common terminology in the self-care world. And this is a living document that will continue to update as we, self-care landscape is evolving, and we certainly welcome your feedback on it. The GAC also hosted, and this is ongoing, there's a community forum series. Last year, our sessions focused on, were included with youth partners, and then we had a separate session on gender. And the goal of the series is really to hear directly from these communities in terms of their needs, their advocacy objectives, and really strengthen the SCTG's relationship with these specific thematic and topical groups. We've also hosted a self-care workshop within the Triennial Congress of the International Confederation of Midwives. And before that, there was a self-care advocacy and accountability roundtable at the ICFP Not Without FP Forum. Of course, we'll continue that in partnership with the other working groups of the SCTG at the upcoming ICFP 2022 conference later this year. And of course, all the campaigns that you are seeing on our social media channels or on our website, whether it's around International Women's Day, International Self-Care Day, International Condom Day, 12 days of UHCs. I know there's a lot of days, a lot of awareness days. These are really led by the GAC and our partners. We'll continue this this year, and we'll always invite you to participate. Currently, right now, we are having an awareness campaign around World Health Worker Week. So please help us amplify. And then in terms of advocating for self-care policies, the GAC hosted last year the second ministerial dialogue, which we had high-level representation from 10 ministries of health, 10 countries, representing about 3 WHO regions. And of course, we invited donors agencies to also share the work that they're doing in self-care and where do they see, what's the vision for the self-care space moving forward. And we certainly keep mobilizing partners around the gender issue. A number of our partners work with the GAC to make commitments to Generation Equality Forum that included self-care. Next slide, please. Now, some of the challenges that we are seeing, even though it's been about over 3 years of us promoting self-care, we're still seeing a lack of understanding and awareness when it comes to self-care, not just at the global level, but also at the country and regional level. So there is a need for more education and sensitization. Even some of healthcare professionals and those who have worked in the global health space are still need to better understand what self-care is. So we will continue that work. We do see UHC as our North Star, but we know that the global advocacy in the UHC space has stalled due to COVID. So we are figuring out different opportunities to continue the same work. And really, when the UHC global advocacy work starts back up, we'll of course make sure that our work aligns with it. There is a question of limited bandwidth. And here I'm speaking respectively to our partners. We know that many of you wear multiple hats. Oftentimes, our self-care communication advocacy effort requires us piggybacking off of different campaigns that are ongoing. The good news is that it does allow us to broaden the topics and the subject matter that are being covered, whether it's working with the Global Menstrual Collective or partners who focus on mental health, but it is something that we're paying attention to. Next slide. So in the interest of time, I won't dive into all of this, but our activities in 2022 are really focusing around continuing awareness generation, whether it's outreach to different stakeholders that fall into the gender, provider, or UHC space. We'll continue to develop our advocacy materials and host different events. We'll continue to do these high-level engagement with governments in 2022 and 2023, well, really around the theme of UHC. And then something that we are paying attention to is really mobilizing donors to fund the self-care space, not only the SCTG, but really cultivating, crowding in more funding for self-care writ large. Next slide, please. Now, who should get involved? The GAC is not only limited to communicators or advocacy folks, professionals. We really welcome everyone. So if you're interested in advocacy and communication around self-care, please sign up if you're not already a member, and then you can join the working group. Different ways you can engage, including becoming an SCTG member, really participating in events, amplifying our campaigns, and then certainly using our tools. Thank you so much. Over to you, Aissatou.
Sandy, do you hear me? Il semble que Sandy a quelques problèmes de connexion.
Aissatou, en fait, c'est à vous. Non, vous m'entendez?
OK. Go ahead, allez-y. Vous avez encore 1 minute.
Sorry. I think apologies all. I thought my time had run out. So very quickly, in terms of how to engage with us, we encourage you, whether you want to join the GAC or any other working group, to sign up if you're not already a member. So become a member of the SCTG, and then you can choose which working groups you join, whether it's the LWIG, GAC, or Country Advocacy Working Group. We do encourage you to partner with us, not only participate in events, but you can co-host or co-sponsor events that are being organized by the GAC. Certainly encourage you to amplify any GAC-led campaigns, digital or otherwise, or our content through your organization's channels. We invite you to use the advocacy tools and resources, and also the evidence resources, and please always provide feedback. We invite members also to write original blog pieces, or if you have content that your organization has produced that focuses on self-care, please send it our way, and we'll certainly share it through our own channels. And of course, always reach out to us if you have other ideas in terms of partnerships and other opportunities that we can leverage. Thank you so much. And with that, Aissatou, c'est à vous.
Sandy, désolé, nous avons quelques difficultés pour vous. Oui, je disais qu'on a quelques difficultés pour vous entendre. Apparemment, vous avez des soucis de connexion. Oui.
Sorry, can you all hear me now?
OK. Alors, je pense qu'on devrait peut-être aller sur Mindy. Désolé, hein. On a vraiment des difficultés pour vous entendre. On vous a perdu. Je pense que nous allons poursuivre. Merci quand même pour cette présentation. Maintenant, nous voulons donner une nouvelle fois l'opportunité aux participants de les entendre. Donc, on va retourner sur menti.com. Next slide, please.
Previous slide, please.
Désolée, je pense que les problèmes de connexion, c'était à mon niveau. Heureusement que tout le monde vous a bien entendu. Je pense que si vous avez fini, on peut peut-être retourner au partage d'écran.
It's not a problem, Aissatou. Ça arrive.
Thank you all for your participation in the Mentimeter. It may be that we're having internet connection issues with Aissatou, so I'd just like to jump in and move the conversation forward. I think from the Mentimeter, we've received good responses to the advocacy and communications activities that you're interested in. I see a lot of interest in the tools, and so we'll share the link for where you can get those tools. That's exactly what we'd like to hear from you. So thank you, Sandy, for leading that session. Our next presenter, I have to deal with a bit of French. Our next presenter is going to share with us the work of the Country Advocacy Working Group. And the presenter is Angela Nguku. Angela Nguku works with the White Ribbon Alliance. So I'd like to welcome Angela to just share with us some highlights from the Country Advocacy Working Group. Thank you.
Thank you, Sarah. And it's been a pleasure just listening to what has been happening across different countries and what different players are doing around the self-care work, which is something I'm really passionate about. My name is Angela Nguku. I'm calling in from Nairobi, Kenya. I'm the Deputy Chief Executive Officer for White Ribbon Alliance. Today, I'm sitting in for my colleague, Kim Wipke, who co-chairs the Country Advocacy Working Group. She's currently on a short leave. White Ribbon Alliance is a people-led movement for reproductive health and rights. And what we do at White Ribbon Alliance, we really ask women, listen to them, and act on their demands and call other people to really act on the demands that women and girls are telling us as concern their sexual reproductive health and rights. White Ribbon Alliance serves as the learning and advocacy lead with the Self-Care Trailblazer Group and co-chairs the Country Advocacy Working Group. Next slide, please. And the purpose of the Self-Care Advocacy Working Group is really to provide a community of and for individuals and organizations who are interested in or actively working to advance self-care through policy, programmatic, and public advocacy at national and subnational level. And so basically what this does is connecting interested advocates within and across countries to spark or amplify joint efforts, highlight successful or in-progress case examples of self-care advocacy, to encourage potential replication, create space to share lessons learned and strategize solutions to shared self-care advocacy challenges, and sources and disseminate tools to accelerate self-care advocacy wins. So if you want to know what to do at country level, I think this is a place really to ask those questions. Next slide, please.
Angela, could you just speak slowly so that the translators can translate?
Okay,
just a little slower,
I will
please.
do that.
Thank you.
Thank you, Sarah. And so I just want to share with us the key successes since launching the Country Advocacy Working Group. And the first ever meeting was held in May 2021. And it was hosted with the Advanced Family Planning. I think all of you might be aware about the Advanced Family Planning group that came up with the smart advocacy and how to basically develop smart advocacy objectives for your advocacy work. And so this meeting, which was held in March 2021, was focused on how advocates are advancing self-care with a family planning contraception lens at the national and subnational level. And it featured presentations from Uganda and Kenya. And it was attended by more than 100 participants, and it really served as the springboard for the Self-Care Learning Discovery Series. I think that has been one of the places maybe most of the participants here have really been part of the Self-Care and Learning, Learning and Discovery Series. And I think what you see here is what are basically the presentation from Uganda around self-injection and contraception use in Uganda. Next slide, please. And Sarah, if I speak fast, please let me know. I know I can't really speak fast. I hope I'm trying my best. So to go to the Self-Care Learning and Discovery Series, what you are seeing is basically by the numbers. So this was held in June to August 2021 and was a very highly interactive virtual forum for participants to exchange and incubate ideas, experiences, and solutions on a variety of self-care topics. And it was hosted by White Ribbon Alliance on behalf of the Self-Care Trailblazer Group and guided by a steering committee, including representatives from PSI, JPICO, AP, and PATH. We had more than 55 diverse organizations, co-organizers who developed 16 virtual sessions on a variety of self-care topics, ranging from UHC. I've seen UHC as one of the elements that participants want to know more about how to go about in self-care, to bodily autonomy, to the role of healthcare providers in advancing self-care. And it was really an exciting discussion to just listen to us health workers. I'm a health worker myself, I'm a graduate midwife, just listening to what we can actually do to advance self-care instead of pushing opposition. And advocacy was a thread running from through each of the sessions. I think the Self-Care Learning Discovery Series was one of my best series to attend, and I would really wish that this is something that continues because there was a lot of learning that really took place. We were able to mobilize more than 1,858 registrants from 119 countries. About 2/3 of these registrants were from the Global South, with highest participation seen from the US, Nigeria, Kenya, India, and Uganda. The majority of these participants were young and middle-aged women, and of course that shows the keen interest in self-care from a very key demographic. We know those are the people who are really will go for family planning, contraceptives, want to know more about their changing bodies and the like, how to really space their children and all that, and really that was a big deal for this. Sessions with the highest attendance rate included the self-care in humanitarian settings, something which is really struck very much. Self-care and digital health, self-care health literacy and decision-making, and self-care led by young people. And from the evaluation surveys that we received, the vast majority is that they learned something new from this learning and discovery series. Of course, the whole series was about learning and discovery, which was a new thing. And importantly, the discovery series helped to grow the self-care movement, with 755 individuals that they were not Self-Care Trailblazers Group members before the series, but were interested in becoming members and learning more about that. Next slide, please. The second success, really, since this was initiated, was the Self-Care Smart Advocacy Workshop. We had virtual workshops organized by White Ribbon Alliance, Advanced Family Planning, and a Reproductive Health Supplies Coalition on behalf of the Self-Care Trailblazers Group for the country advocacy working group members. And it was really grounded in the smart advocacy approach developed by AAP, which I talked about earlier. And the process was about informing and influencing a key decision maker to change policies and mobilize resources around self-care. I can see that as White Ribbon Alliance in Kenya, where I've been and where I still sit, we were really part of this, and there was a lot of learning. Even my team, a lot of times they share around some of the learnings that they took on and they took out from this smart advocacy workshop. We had a cohort of 40 active participants where they developed targeted country advocacy strategies to advance self-care with a particular focus on adopting, or implementing some of all of the WHO self-care guidelines, which was launched sometime back in 2018, 2019. And This workshop really ran parallel to the self-care discovery series, so that participants could actually incorporate the learning from the series into development of their own self-care advocacy strategies, which I thought was really a good thing, because at least there is learning and practice at the same time. And in addition to the topics that were really listed, that are listed on the right, that you can see on the right, I don't know whether this is red or orange. In the screen it appears red or orange. One thing to note is that several self-care advocacy strategies focused on strengthening the enabling environment for health providers to promote self-care strategies and stroke interventions. For example, the group in Liberia focused on the MOH approving the inclusion of self-care in the revised community health assistant policy and curriculum, while the advocacy strategy in Peru focused on the Directorate of Integrated Health Networks implementing a training plan for health personnel in sexual reproductive health services and self-care for adolescents in one district in Lima, which the whole object, the strategies were really diverse, and I think that speaks to the need for really embracing self-care. I know in an era where we are talking about inaccessibility, and of course with the pandemic actually being at the same time, inaccessibility of health workers, health providers, and more need for health seeking. And so self-care really comes in to really play a key role in that. So 16 organizations from the workshop made a self-care advocacy joint commitment under the Generation Equality Forum. I'm sure some of you have really seen the commitment. If you have not, we could actually share that with you. Next slide, please.
Angela, you have just 1 minute.
Thank you. I'm about to finish actually. On the challenges that we've really faced as a country advocacy working group is lack of dedicated funds to support implementation of the self-care smart advocacy strategies that were developed in countries. Limited funds for self-care advocacy in general has also been a challenge. What White Tribunal Alliance has done is we've tried to connect advocates with funders wherever possible. And the other challenge was really converting those who joined the country advocacy working group into official members of Self-Care Trailblazers Group and the country advocacy working group. So what we've done is that we've opened up meetings to whoever wants to attend to help broaden the tent, but we are now putting greater emphasis on ensuring that those who participate deepen engagement with the Self-Care Trailblazers Group, including becoming a member. And what is really next? Next slide, please. What is really next for 2022 that you can start preparing yourself to be part of? The quarterly meetings continue. In March, we held the learning meeting, the Stroke Exchange, which was co-hosted by the Coalition for Adolescent Girls and White Tribunal Alliance. It was titled Where Adolescents, Advocacy and Self-Care Meet. In June, we'll have another meeting or learning exchange co-hosted with the Interagency Group on Reproductive Health in Crisis. The date is still to be confirmed, and it's going to focus on humanitarian and fragile settings and self-care. In July, there will be the joint meeting on national self-care guidelines. And I think you can see from the slide that there's a lot that is happening, including the Discover Self-Care at the ICPF, which is the International Conference on Family Planning in 2022. And of course, a post-conference exchange, and the working title is yet to be shared. On documentation and tools dissemination, we are working to feed self-care advocacy milestones into State of Self-Care report, develop or update the self-care advocacy case studies and examples, and of course, support webinars and events to increase awareness, understanding on key self-care policy and advocacy tools. So,
Angela, you have 30 seconds. I'm sorry.
But the last slide is basically to how you can get involved. Next slide, please. You can become, if you want to get involved, you can become an official member, join a quarterly meeting, share your self-care and advocacy wins and successes, disseminate your tools and updates, check out the 2021 Self-Care Learning and Discovery Series. We can share the links to the recordings and the lives. Help us incubate for the International Conference on Family Planning and, of course, a post-conference learning exchange on self-care. So we really look forward to getting involved with you at country level where the action is, and really been a pleasure talking to you. Thank you. Thank you. Back to you, Sarah.
Thank you very much, Angela, and really apologies for rushing you. Thank you all for being with us for the last 2 hours. Our time is up, so we're encouraging you to please put your questions on the chat box. You can also answer the last Menti question on the chat box or live on Menti. So really sorry to be rushing us, but we do need to close the meeting. So I'd like to hand over to the chair of the Coalition Steering Committee, Solome, to give us some closing remarks. Thank you.
Thank you, Sarah. Thank you, Sarah. And I'd like to really thank us all for the last 2 hours. We've listened to each other, we've learned from each other, we've shared experiences, but also we've shared challenges and milestones. Thank you for sharing your thoughts on this dialogue. And as indicated in my opening remarks, the power of the SCTG is around its membership. Therefore, I'd like to encourage those that are not members yet to consider signing up. We've already shared that. And also it's on the screen with you there. Consider joining us, but also those that are members, I'd like to encourage you to sign up to one of the working groups, which have the last 3 presentations have been sharing with us the working groups and the kind of work that they're doing. There has to be something that is exciting for you. A lot is exciting, so please join the working groups. And also, if you have any other questions, please reach out to us. The details are still on the screen so that we can find ways of how to collaborate, to increase more knowledge, but also to share your experiences, and so that together we can champion self-care globally. So I'd like now to bring this to a close by inviting Sarah back to say her closing remarks on behalf of the Secretariat. And I'd like to thank you all on behalf of the Steering Committee, which I chair. Thank you very much.
Thank you very much, Solome. And for me, it's just to thank everybody for being able to join us in this session today. We wouldn't have done it without you. We really are grateful to the panelists, to the presenters, to the moderators for taking time to make this meeting a success. I also want to really mention the translators. We were able to reach our wider audience with the Spanish and French translations. And thanks to the Secretariat, the Steering Committee, and everyone for working behind the scenes to make this event the success that it is. We look forward to continuing to engage with you, and we're particularly hoping we can involve you next year in co-sponsoring the summit with us. Thank you very much. Have a good day wherever you are. Good evening, good afternoon. Thank you.